In this particular study, we evaluated the use of an oral arsenic trioxide-based regimen comprising oral arsenic trioxide, all-trans retinoic acid, and ascorbic acid for patients with acute promyelocytic leukemia in a newly diagnosed or induction situation. So in this particular study, we recruited 117 patients that were enrolled, including both standard risk and high-risk patients, and also patients of all ages. So in this particular regimen, the so-called AAA regimen, patients with a white count of more than 10 will be given 3 days of daunorubicin. Patients with a white count of less than 10 or patients with comorbidities or age above 65 will be treated in the chemotherapy-free manner. And after achieving a remission, this patient would undergo consolidation, with consolidation phase was chemotherapy-free. So with a median follow-up of more than 30 months, a 97% overall survival and relapse-free survival was observed. There was only one relapse in this study, and that was in a patient with a mutation in the PML-B2 domain of the PML-RARA that conferred resistance to oral arsenic trioxide. There were no other relapses. And there was one death in remission in a person with multiple comorbidity, and the death was deemed not related to the regimen. So all other patients are doing very well in prolonged remission. So in conclusion, it shows that this all-oral regimen is safe and efficacious in patients of all age groups, in patients with acute promyelocytic leukemia. So as a next step forward, we would be planning a phase 3 randomized controlled trial comparing AAA regimen with intravenous arsenic trioxide.